My advice to people who have been having some trouble getting pregnant and they're thinking about visiting a fertility specialist, but maybe they're a bit apprehensive about what that might entail, I would try to reassure them that this initial evaluation is pretty mild. So it usually just takes the form of a conversation just to start with. Based on that conversation, we're actually able to get a fair amount of information about what might be going on with their situation. And then the testing is usually pretty simple. It just takes the form of a very simple ultrasound for the woman and a few hormonal blood tests, and for the man, just a simple look at the sperm. It's called the semen analysis. With those pieces of information, which can usually be done within about a week to 2 weeks of the initial visit, then about 2 weeks later, we would have the information to really get them started on what their situation is and what kind of treatment they may need. It may be that they don't need anything. It may be that their testing all looks reassuring, and maybe it wouldn't be a bad idea if they just gave it a little bit more time. But they can at least know where they're starting from. I see a lot of those patients that tell me, it took me a year to work up to this visit, and I'm here, and I don't know why I waited so long. This was so simple, and you made it really understandable, and I don't really know why I was so scared. I think the thought is that if people sign up to see a fertility doctor, that they're somehow admitting that they have some irreconcilable problem, and it's too painful to think about that they may not be able to have a family. Most of the time, though, that's not the case.